Okay, our topic for this morning is actually about drugs for diabetes. But before that, let's revisit the glycolysis process that you had during your biochemistry, because this is very important in the study of drugs for diabetes. So we have glycolysis, syempre, this one starts with glucose. So the one that we really consume is most of the time polysaccharides, but inside the body it will be broken down into glucose. So other types of sugar like fructose, gina-consume nato from the fruits we eat, will still be converted into glucose in the body. So everything ends up with glucose when it comes to sugar, and sugar will be broken down to give us energy. The process is again called glycolysis. So this is the process. Glucose, through the enzyme hexokinase, it will become glucose 6-phosphate. And as you can see, you have their ATP to be converted into ADP. It means, class, na when you convert glucose to glucose 6-phosphate, you are using energy. So before we can break down glucose to make a lot of energy, kailangan ka munang gumamit ng energy mismo. And then glucose 6-phosphate will become fructose 6-phosphate. The yellow ones are the enzymes responsible, Fructose 6-phosphate will become fructose 1,6-bisphosphate, and this will be divided into 2. Okay, into 2 kasi 6 carbons yung fructose 1,6-bisphosphate. Divide siya into 2, tagtatatlo sila na carbon. We have the first one, glyceraldehyde 3-phosphate, and the other one is dihydroxyacetone phosphate. But both of them will still end up becoming 1,3-bisphosphoglycerate hangtod na mahimo siya 3-phosphoglycerate, 2-phosphoglycerate, and then you will have the phosphoenol pyruvate, and then the last product for glycolysis is the pyruvate. Okay, so this one, all in all, is the process of glycolysis. So the process of glycolysis involves using ATP to convert one substance to another substance. But at the end part of the glycolysis, this is where you can see that there is the formation of ATP. From ADP, gagawin siyang ATP, and that is our energy, our source of energy in the body. Aside from that, the NADH will also be another source of ATP. But this one is not complete when it comes to the production of more ATPs, because pyruvate will be converted to acetyl coenzyme A, and acetyl coenzyme A will enter the Krebs cycle. And in the Krebs cycle, that is where you can see a lot of ATPs being produced. So all in all, glucose is our physiological sugar, our number one source of energy in the body. But it should be at a certain level. Dili siya pwede mag-exceed, because when this one increases in the body, especially in the blood, this is where diabetes comes in. So in this chapter, we will be discussing the drugs used sa diabetes mellitus. Okay, so let us start with this one. Our key organ here is the pancreas. Actually, it's an endocrine gland secreting a lot of hormones. So this one is the pancreas here. And specifically, we need the pancreatic islet, or the islet of Langerhans. These are cells, these are tissues or group of cells in the pancreas that are responsible in the production of different types of products, most of the time hormones. So we have 1, 2, 3, 4, 5 types of cells found in the islet of Langerhans in the pancreas. And ang pinakadaghan ano sa ilaha are the beta cells. So 75% actually are the beta cells, and that is responsible for the production of insulin or other products. We also have the C-peptide, the proinsulin, and even the amylin. The alpha cells, however, produces glucagon, and it's what do you call that? apoenzyme pro-glucagon. And then we also have the delta cells. Actually, gamay lang yun kaya na sila, but they produce somatostatin. The G cells produce gastrin, and lastly, the F cells produces the pancreatic polypeptide. So let's discuss these secretory products. What are their responsibilities in the body? They're actually hormones. So let's have the first one, the insulin. The insulin are the storage and anabolic hormone of the body that regulates the blood glucose level. So without insulin class, glucose will not be used as a source of energy. Thus, there will be an increase in the blood sugar level. Mag-increase ang blood glucose level without insulin. Bakit? Kasi ganito. Sa first part, ang pinakaunang bungad sa ako ang PPT is actually the glycolysis. And take note that glycolysis takes place inside the cell. Inside the cell specifically in the cytoplasm. However, remember that glucose is a very big molecule. And as a big molecule, it needs facilitator to go inside the cell. And the one that facilitates it is the insulin. So without insulin, glucose cannot enter the cell and it cannot undergo glycolysis to produce the ATPs that we need. So ang ending, si glucose magstay sa blood. And when you check your blood, you will really have increased blood glucose level if you have deficiency sa insulin. Okay? And then remember that glycolysis ends up having pyruvate, and then it will be converted to acetyl coenzyme A, and this one undergoes Krebs cycle. Now the difference is that glycolysis happens in the cytoplasm while Krebs cycle happens in the mitochondria. So Krebs cycle produces a lot of ATPs, and since it takes place in the mitochondria, that is the reason why mitochondria has become the powerhouse of the cell. Kasi ATPs are being produced there. I hope na nasabta na siya. Okay, questions about insulin and its production? What type of cell again produces insulin? Again, what type of cell in the pancreas produces insulin? Alpha, beta, delta, F cells? What is that again? The beta cells. Okay, very good, Madreda and the ally. It's the beta cells that produces insulin. Now, how about glucagon? The glucagon is the reverse. Okay, its action is the reverse of insulin. Si glucagon naman is a hyperglycemic factor that will mobilize our glycogen stores. So what happened? If we consume a lot of glucose, some of them undergoes glycolysis to give us energy. But if we consume glucose in excess, 1 cup lang man di ba ta dapat, pero kung inyuhang gikaon kay isa ka kaldero, that will be an excess. So this time it will be stored as glycogen in the liver and in our muscles, the excess of that. Glycogen siya. Glycogen is a polysaccharide, so ang glucose class idugtong-dugtong gihapon to form the glycogen. Now, in the time class na we will be depleted with source of glucose, for example, we go on hunger strike, we diet, or basta we don't eat, therefore we don't have glucose na source, then it's the time of glucagon to take its action. It's a hyperglycemic factor, which means it will break down, it will facilitate glycogenolysis. meaning it will facilitate the breaking down of glycogen so that si glucose ma-release. So ma-release siya in the blood, kaya hyperglycemic factor siya. Okay? So baliktad ang ilahang action. Insulin will facilitate the breaking down of glucose for us to have more energy, but glucagon, insulin will decrease the amount of glucose in the blood, but glucagon will actually increase the level of glucose in the blood. So saan galing yung glucose? It's from the glycogen being stored in our liver or our muscles. That's the actions of insulin and glucagon. Now, how about somatostatin? Somatostatin is actually a universal inhibitor of secretory cells. So it has nothing, it really has nothing to do with diabetes. However, it's still a hormone produced by the pancreas. And then we have the islet amyloid polypeptide, the IAP, or we call it amylin. This actually modulates appetite, even gastric emptying, and also glucagon and insulin secretion. Actually, I have seen amylin sa mga appetite na stimulant na mga vitamins in the market. If makita ninyo, so kanina ka ng mga Propan. I don't know if Propan has really amylin. I cannot remember what product is that, but we have a lot of appetite stimulant in the market that contains amylin. But this one is actually produced by the pancreas to modulate our appetite. But aside from that, it can also facilitate the gastric emptying and the secretion of both our glucagon and our insulin. Okay? Yeah, yung propan with iron. It's the propan and the propan with iron, propan TLC, actually is a stimulant for appetite. So especially for children. But I think we have propan for adults. If the adult has problem with eating, may mga eating disorder. Yeah, with iron. Anong yung nasa FB now? Ano nasa siya? Nasa FB siya. Anyari? I am not updated. Yan no, nag-FDA advisory about propan iron. Wala nila na renew ilahang product registration. Ginagamit pang pataba. Nag-viral, wala kayo kita. Ingana na ako ka-busy. After our class last Saturday, I was actually knocked out. So, wala ko naka-FB. I had my migraine last Saturday. Isa na siya oras nawala. Actually, nawala siya kay tungod. Inuman na yun ako siya sa doon, di na makaya. Akala, sabi mo ng hubong. No, actually, propan is really used as appetite stimulant for like malnourished na mga bata para matambok sila. Yeah, pantay siya kasi it has nothing to do with the fat na storage actually. Its action is more on the appetite para magsigi kag kaon. Pero I don't like that. I think most of us don't need propan to increase our appetite. Kaya murag taas na gid atong appetite karon pa lang without the help of propan. So dili na to kailangan. For children class na dili ganahan og kaon kana ano na siya, ginahatag. Okay? Now, the gastrin, which is also produced by the pancreas, from the name itself, gastrin, this one will facilitate the secretion of our gastric acid. So it goes hand in hand. I mean, actually, if gastrin is produced by the pancreas, it will stimulate the production of histamine. Remember when we discussed histamine, one action of histamine is actually the production of the gastric acid. So ano na sila? They will work hand in hand para ma-produce ang gastric acid natin. No need ang reset. Yeah, actually there are certain vitamins And since it is an appetite stimulant, kailangan na siya og reseta. However, since it is marketed as a vitamin, as a supplement, so that is the reason why hindi na siya mapalit sa pharmacy without the prescription. But if we are really strict as pharmacists, if we are really strict with the prescription and the non-prescription drugs, if may RX ang atuang label, kailangan yun dapat na siya og reseta. It has something to do with our practice sa pharmacy here. Okay? Now we have the pancreatic peptide, which is also a small protein being produced by the pancreas that also facilitates digestion. Pero until now, hindi pa kasi alam kung ano talaga yung mechanism, how it facilitates digestion. So limited ang ating information about this small protein being produced by the pancreas. Okay? Questions so far? Yeah, that is the reason, Alay. When you're working in a community pharmacy, you have to balance kasi patient care and business. So having actually a community pharmacy is not an easy job. Kailangan yun ka mo balance na you have to care for your patient, you have to practice rational drug use. But you have to see to it na dili mabankrupt yung mga pharmacy because community pharmacy is still a business. Kailangan natin na siya as pharmacist, we have to learn how to balance that one. Okay? Unang, there are pharmacists na even if supposedly like Propan, it's a prescription drug, ginaanan na lang nila. Ginagawa nilang over the counter. Pero if you do that, if you will become a community pharmacist someday, if you are going to do that, you have to make sure na you will give the patient proper information and you have to see to it na walang harm na mangyayari sa kanila even if you give them the prescription drug. So i-counsel ang patient how to take it, what is the right time to take the drug or to take the Propan, for example. Ihatag ninyo na tanan information. Okay? Next. Any question about the hormones before ta magsugod sa ato ang DM? Diabetes mellitus. This is different from diabetes insipidus, ha? We are done with the diabetes insipidus. The diabetes insipidus is there is problem with the production of the ADH, the antidiuretic hormone. So it has something to do with the production of urine. But this time, diabetes mellitus is on the blood side, wherein you will have a viscous na blood and even sugar in your urine. Okay, there will be elevated blood glucose level. So diabetes mellitus, the symptom here is there is an elevation in the blood glucose level, which is associated with either the absence, meaning hindi talaga nagpo-produce yung ating pancreas ng insulin, or there is insufficient insulin. There is insulin, but it is inadequate, insufficient, being produced by the pancreas, with or without concurrent impairment of insulin action. What do you mean by that? There are diabetic people that has sufficient insulin production. Meron silang insulin na sufficient, pero they have elevated blood glucose level because they have impairment sa action ni insulin. Meaning their cells are insensitive to the action of insulin. So walang mangyayari. Maraming insulin pero walang action. Diabetes mellitus pa rin ang ending. So pag DM class, insulin jud ang may problema. Either hindi ka napoproduce ng insulin, kulang ang iyong insulin, or enough ang insulin pero there is impairment sa kanyang action. Okay? Questions about the description of our diabetes mellitus? Our DM? So, tubig na kayo, nilubad na ko tingin. Wala. So let us continue. We have here abnormal insulin sensitivity. So everything occurs because of problem with insulin. There is abnormal insulin sensitivity. Before ka magkakaroon ng diabetes mellitus, we have first the hyperinsulinemia. There will be increased level of insulin in the blood because again, the cells has problem with its action. So the result if you have increased level of insulin in the blood will be weight gain. And then, ano pa jud, madugangan pag yun kay wala kay ginahimo, there will be physical inactivity that will result to central obesity, mutambok ka, and most likely ang increase in the weight is more on the center part of your body like your stomach, mudako. And that will result to insulin resistance syndrome, meaning you will have enough, actually you will have more insulin pero you will have resistance to its action. May ano kasi klase, insulin has actually a receptor sa cell. Pag mag-bind na siya sa iyahang receptor, that's the time it will facilitate the glucose entrance to the cell. Pero kung ang imuhang receptors have problem, then insulin cannot really bind to it and hindi siya magkakaroon ng action. We call that insulin resistance syndrome. Now, after that insulin resistance syndrome, there will be progressive loss of the beta cells. What's the reason why mamatay ang mga beta cells in the pancreas? It can be because of genetic factors. So diabetes mellitus is really passed on from generation to generation. It's a genetic disease. However, high glucose level and high fats in the body can contribute to the death of the beta cells in the pancreas. So the result of that will be impaired glucose tolerance and diabetes mellitus. The ending will be having a diabetes mellitus. So how do we diagnose DM? We can check syempre the blood glucose level. It can be fasting blood glucose level. If it is increased like more than or equal to 126 milligrams per deciliter, it can be called DM na. Okay, namagayuban slightly elevated. Our normal is like less than or equal to 110 milligrams per deciliter. Nayuban slightly elevated like 119, 120. But if it's more than 126, that's the time we call it diabetes mellitus. Sabi na basta kanang chronic na like sige kag test niya more than 126 yun siya, diabetes mellitus na gid na siya class. Okay, and then aside from the fasting blood glucose level, we can also do the OGTT, that's oral glucose tolerance test. Anong ginagawa sa OGTT? Pinapainom ng glucose. Again, pinapainom ng glucose. Muro na siya orange ang iyang color kasi siguro gilagyan ng flavor na ng orange. Pero glucose siya na solution, ipainom mismo sa imuha. And after 2 hours, i-check ang imuhang blood glucose level. If it's more than 200 milligrams per deciliter, that's an indication also that yes, you have diabetes mellitus. Pero ma'am, kung maggamit o glucometer, need mag-fasting. Pero mag-test sa need mag-fasting. It's up to you. If you're doing a fasting blood glucose testing, you really need to fast. So at least 8 hours. And that will be our normal level, less than 110 milligrams per deciliter. But if you just want to check random blood glucose testing, that's a different one. Pag random lang is any time of the day, you don't fast, you eat everything you want to eat. Our limit is 200 milligrams per deciliter. So if it's more than 200, that's an indication that you have hyperglycemia. Okay? But random blood glucose testing kasi is not reliable because your blood glucose level will be dependent on how much you eat and what food ang kinain mo. Siyempre, kung carbs lahat ang kinain mo, you will expect na you will have increased blood glucose level. So, ang tinatanggap talaga na testing for the diagnosis is the fasting blood glucose level. You can have the OGTT or you can have the HbA1c. So that's another test. It's in the blood also. Pero HbA1c actually test the blood glucose, the glucose that is that is bound to the red blood cells. So kapag manggod class, if you have diabetes, kadugayan manggod ang imuhang sugar, mubind manggod na dito sa imuhang red blood cells. And that will stay there for longer period of time. So mo na siyang ginatest sa HbA1c. Our normal is less than the 6.5. So pag mag more than 6.5% ka sa imuhang glucose nga nakabind sa imuhang red blood cells, meaning you really have diabetes mellitus. And ang pinaka-reliable talaga na testing is the HbA1c kasi it can detect the diabetes mellitus even backwards 3 months. Kung elevated na siya, meaning dugay na ka na IDM, dugay na, mga 3 months na ka or more na ay diabetes mellitus. So sa hospitals, they don't really just perform the fasting blood glucose level. They also perform the HbA1c to really confirm that the patient has diabetes mellitus, dili lang siya hyperglycemia lang. Kasi especially if bago tangkaon, we really experience hyperglycemia. Pero it does not mean na we have DM. So kailangan pa na siya i-check. Either FBS or the HbA1c. So take note of the numbers. If you have your glucometers sa inyong balay, syempre you cannot do the HbA1c. You can just have the fasting blood glucose test or FBS. Pwede ka mag-fast sa gabi. Sa gabi, kalisod kayo mag-fast sa buntag, gutungon yung ka. So sa gabi, and then early in the morning, mag-test ka sa imuhang blood sugar level. So the normal is 110 pababa. Pero paki-check first sa unit na ginagamit sa inyuhang tester. Kay basig dili milligrams per deciliter. Pa-check lang nana sa manual sa inyuhang tester. And then ibutang po na nila din ang normal level. Kung lahi nga unit. Okay? Questions? Questions about this before we'll move on to the types of diabetes? Wala. Sige, let's have the 4 types of diabetes mellitus or the 4 categories. Type 1 is also called the insulin-dependent DM. Type 2 is the non-insulin dependent DM, and ito yung pinakamarami nowadays. 90% of the people with diabetes actually has type 2 diabetes. They are non-insulin dependent. Type 3 is the Alzheimer's disease or pwede siya others. Actually, some books label this type 3 as others, meaning other causes of the diabetes mellitus, including the Alzheimer's disease. And then type 4 is gestational diabetes mellitus. Alzheimer's disease because people with Alzheimer's disease always has DM. Because of the action of the different substances involved in Alzheimer's disease, magkakaroon sila ng insensitivity to insulin. So mauuwi into DM ang mga naay Alzheimer's. Okay? Let's talk about the different categories one by one. When you say type 1 DM, you have selective B-cell destruction, meaning magkakaroon ng problem with your beta cells in the pancreas, and that will result to either severe or absolute insulin deficiency. So the patient here, kung absolute class, wala gyud iyahang body nagaproduce og insulin. Now, what are the signs and symptoms of having a type 1 diabetes mellitus? There is insulin deficiency, which results to polydipsia. Polydipsia means pirmi sila uhaw. Again, polydipsia is pirmi uhaw. Polyphagia or polyphagia, which means pirmi sila gutom. So excessive thirst, excessive hunger, and polyuria, pirmi sila gaihi. So kaihion sila pirmi. There will be excessive urine or excessive urination. And then there will be weight loss. Actually, ang mga people with diabetes mellitus always have weight loss if they have increased blood glucose level. Ngano man na? Ngano kaya nasa tanaw ninyo mamayat ang na IBM? Anyone? Or manawag ba ko? Or na gusto mag-volunteer? Why do you think mamayat ang person with diabetes mellitus? Wala? Sa diet nila? What happened to their diet? For example, ikaw, wala ka kabalo nga na kay diabetes mellitus. Ikalit kag kapayat. Actually, mukalit na sila kapayat. And then, they don't know na daday sila DM. Kasi sa fats na sila gakuha ng energy. Or question mark, di sure. Actually, that is correct, Isobel. Insufficient insulin prevents the body from getting glucose from the blood into the body cell to use as energy. When this occurs, the body starts burning fat and muscle for energy, causing a reduction in overall body weight. Tama, Rosel. Actually, parehas lang na siya. I-explain lang ang answer ni Isobel. According to Google. Too much glucose. May answer mo na lang si Google. Yeah, may answer si Google. Tama, may recitation na si Google. Actually, tama na siya, class. So, di ba, our source for energy is glucose. However, we have problem. The people with diabetes have problem with insulin. So, glucose cannot enter the cell. Dili na siya maka-enter sa cell. So, walay glycolysis. Pag walay glycolysis, there is no ATP. There is no energy. But since we are alive, therefore we need energy. So the people with diabetes mellitus will look for other source of energy in the body kasi nga hindi nila magamit si glucose kasi hindi siya makapasok sa cell. So ang ginagawa is fats will be broken down or even the muscles will be broken down just to release energy. Because remember, fats contain energy. Pag ma-breakdown na siya, it will become acetyl coenzyme A, and this acetyl coenzyme A will be having the Krebs cycle. So in the end, this will produce ATP. Muscles also contains proteins, and when proteins are broken down, it will also become acetyl coenzyme A, and ang ending pa rin ay ATP. So since na-breakdown ng fats, na-breakdown ng muscles, mo na siya class na there will be weight loss. Okay, so that is the reason why people with diabetes mellitus will really, mamayat dyan na sila. They will have weight loss. Unexplained weight loss, ha? Kasi they don't really diet. They don't really go into diet. But mukalit silang payat. Okay? Yeah, so that is the reason why kanang wala man sila nag-diet, tapos mukalit og kapayat gani. It might be because they have increased blood sugar level. So if you know someone, it might be your family or relative na they don't really go into diet but suddenly there is weight loss. Advise them to check their blood sugar level kasi basig increase na yun ilang blood sugar level ana. Yeah, magpayat yun na sila kasi the body will be looking for another source of energy and the body will shift to fats. So mawala gid ang fats na nakastore sa ilang body, mao na nga mamayat sila. I hope na intindihan yan siya ha, bakit mamayat. Ang naay people with DM. But take note class that energy coming from fats is not really that strong. So mo na nga dali sila kapuyon. So kabantay mo sa mga people with diabetes, madali silang mapagod. Kasi pag glucose, sugar ang source natin sa energy, that's a strong one. Grabe ang source grabe ang ginahatag nga energy. So we are really strong. Dili ta dayon makapoy. So sila, since fats ang ilahang source sa energy, dali sila kapuyon class. Aside sa namayat sila. Yung kay Mona na diabetes, ma'am, parang naapektuhan lagi ang growth niya, ma'am. Parang bata pa rin siya. Si Mona nga manghudi, diba na, Lawi? Si Mona is actually, ang iyang diabetes is type 1 diabetes mellitus. Okay, type 1. So it's either she has severe insulin deficiency or absolute yun. Wala siya nag-produce og insulin. So ano siya? Insulin dependent. Dili lang na siya taman sa metformin. Actually, metformin cannot help her. Other glibenclamide and other oral hypoglycemic agents cannot help her. Insulin din na siya. Constant na pag-inject sa insulin. And insulin actually class has, if we are going to discuss the insulin ha, namagod sa ako ang succeeding slides na, insulin has something to do with the growth and the fat storage. So people with absolute insulin deficiency will have problem with their growth also. Dili sila mudako, dili pud sila mutambok. Gary V also has type 1 diabetes mellitus. So wala mo kakita kay Gary V nga natambok na siya. Payat yun na siya, permi. Payat until now. So type 1 na siya, insulin dependent actually si Gary V. And most people having type 1 diabetes mellitus, actually class, mag-start na siya sa bata pa sila. Okay? They will be diagnosed when they are still young. Kaya pag makita sa ilang blood sugar level taas, ang ilaha yung pancreas is guba na. So since bata pa sila, ang uban even during birth, guba na ilahang pancreas. So they don't really produce insulin. So bata pa sila, nag-suffer na sila sa ilahang type 1 diabetes mellitus. Gluconeogenesis man. Yeah. Okay, tama na siya, Sarah. Na diba, they cannot use the glucose, so they will look for other sources of energy, and that will be coming from fats and muscles. The process is gluconeogenesis. It's converting non-sugar sources to sugar para makuha na to ang energy nga kailangan. The process again is gluconeogenesis. Tama na siya. Tapos sige gihapon og bisyo, sigarilyo plus alcohol plus walay control sa pagkaon. Na-stress ka, Rosel? Kaya kinsa man ka na-stress? Na-stress ka sa someone, it might be your family or your relative na diabetes and ang bisyo wala na undang. Mag-control gyud. Patients with diabetes should control their diet kasi even if they have their drugs, if they don't really control what they eat, wala effect si drugs. So kung naay DM, tabangan po jud dapat ang drugs class through the diet. Until pila ka generation, it will really be passed on to generation, walay undang. Walay undang. So mag-expect mo, if naa sa inyong family ang diabetes class, nagyud na sa inyong genes, but we can actually choose kano saan na siya magawas. We don't want to suffer from diabetes mellitus na bata pa ta. So we have to control what we eat. Okay? So posible na bisan wala sa parents nimo pero makuha mo. Yes. Even if your parents don't have diabetes mellitus, you can have diabetes mellitus. Because of what we eat, because of your lifestyle, you can have DM. How much more kung naa sa inyong genes? So, it all boils down. Diabetes mellitus, just like hypertension, is a lifestyle disease. So we have to be very careful on what we eat. Questions pa about the type 1 diabetes mellitus? Mostly mga bata ni sila ha. Bata pa lang sila, may DM na sila. May problem sa ilahang pag-produce sa insulin. Okay? Now, let's move on. Diabetes ketoacidosis. This will be the complication of the type 1 diabetes mellitus. Complication. I think I heard na hospital si Mona, no? Na-coma siya. Ay, na-coma ba siya? Basta na-hospital siya, parang there was a life-threatening na condition. Actually, I think nagkaroon siya diabetic ketoacidosis because wala na gyud siya insulin in the body. That will result to the release of excess na fatty acid. Remember, wala na siya energy nga makuha sa iyahang glucose. So, grabe ang pag-breakdown sa iyahang fats class. And ang problem, if daghan na kaayo ang na-breakdown na fats, there will be release of a lot, excessive na fatty acids in the blood. Now, our problem with fats manggod, with fatty acids, when they break down, they will form ketones. They will form ketones in the blood, and that ketones in the blood are actually toxic. So toxic sila. There will be toxic levels of ketoacids in the blood. The condition is called diabetes ketoacidosis, and this is life-threatening. Now, if you ask, what will be the signs and symptoms, ma'am, of the diabetes ketoacidosis? Actually, parehas lang. Polyphagia, polyuria, what else? Polydipsia, and what else? Walay kusog ang patient ani. So pag mag-ihi sila, there will be ketones in their urine. So kung nakatry, kita ta na nakatry gid na magpa-urinalysis, appeal dito, di ba? Do wala man no kanang pasalamatan nan ang nakabutang kay nakabutang dito either presence of protein, presence of sugar, or presence of ketones in the body. If naa gani na makit-an nga ketones in the urine class, it might be because the patient is experiencing diabetes ketoacidosis. So this is life-threatening. Ketoacids ni, so this will change the pH of the blood, and the patient will experience acidosis. And remember, our organs will not function well if lahi ang patient ay ang pH sa blood. Dapat 7.35 to 7.45 lang na siya. Mubaba na siya pag maayo, again due to the presence of the keto acids. I think ko na siya ang reason na na-hospital last time si Mona, and then I think I saw a clip or an interview of her, or si Ivana ba ang i-interview na nag 50-50 si Mona. Feeling na ko kani, nag-diabetes ketoacidosis siya. Yeah, mo na siya ang result sa iyahang insulin deficiency. Nakita na daw niya yung lawas. Masan hiwalay yung kalag. Wala ko kita na interview. Okay, Astral. Astral travel, kanang mohiwalay imuhang kalag. Siguro grabe na ang pagbaba sa iyahang pH na naapektuhan na iyahang brain. Ano siyang hitabo sa iya. Okay? Si Gary V naman, since type 1 DM po na siya, I think sa iyahang belt na siya ay insulin na pump. Sa belt lang niya mismo. So siya lang na nag-inject sa iyahang sarili. Pagka nag-ano na siya, nag-hyperglycemia na siya pag maayo, wala na siya insulin, nag-inject lang na siya na, I think na siya insulin infusion bar pump sa iyahang belt, na continuously nagahatag sa iyahang insulin sa iyahang body. Okay? Wala pangutanan na for type 1 DM. Let's move on to the type 2 diabetes mellitus. So si type 2 naman, okay si pancreas. Pwede nga okay si pancreas, pwede po dili. So ano lang siya, dili siya severe or dili siya absolute yun na insulin deficiency. The body of the person can still produce insulin, but either it is insufficient or number 2, there is resistance. So there is enough insulin production, but there is resistance. Meaning, the cells, the receptors, cannot accommodate the insulin. Therefore, dili makatake og action si insulin, dili niya ma-accommodate, ma-facilitate ang entrance of glucose in the cells. So, leading to hyperglycemia gihapon. Okay? Now, what is the reason? Asa kaya ang reason nga nung mahimog resistant si cell sa insulin? It might be because of too much fats in the body. So as you can see, most of the people with type 2 diabetes mellitus are either overweight or obese. Kasi too much fats can actually lead to inflammation of the cells, and because of this inflammation, there will be resistance. So, mo na ang ginaingon niya mag-diet na ta. Okay? Kay bisan pa og genetically walay genes for diabetes mellitus, but because of the inflammation due to the presence of fats, it can lead to resistance. Okay? So, pag may impaired insulin action na masamot pag yun ang iyahang effect into the fat metabolism, because insulin resistance can increase the free fatty acid in the blood. It can also increase the triglyceride levels, and at the same time, it can decrease the good cholesterol, which is the HDL, which means magsanga-sanga na from having the diabetes mellitus, since there is increased tags and increased cholesterol in the body, nga mababa pa jud ang HDL, magsanga-sanga na siya. You can have atherosclerosis leading to cardiovascular disease. So mo na siya nga napansin nato na people with diabetes mellitus most of the time naapoy cardiovascular disorder. It can be a heart disease or it can be hypertension. Okay? Magsanga-sanga na siya. So everything boils down with the lifestyle. Muna nga mag-diet na ta. Or na urgent need to control what we eat. So, labi na, everything starts with the BMI. So, palihog ko compute sa mga BMI din ha, kung normal pa ba or dili. Yeah, taas og fats, and then may diabetes mellitus. Okay? That's the problem with the type 2 DM. Okay? Now, what are the treatments for type 2 DM? It can be insulin. Okay? So, dili siya necessary nga type 1 lang yun ang pwede hatagan og insulin. Type 2 diabetes mellitus can have insulin also, can receive insulin replacement therapy, or the OHAS. OHAS means oral hypoglycemic agents, just like the metformin. Okay? Now, complications. If type 1 diabetes mellitus class, ang complication niya is diabetic ketoacidosis. The patient will experience acidosis due to the formation of ketone acids. For type 2 DM naman, the complication may be ketoacidosis also, which may result due to stress such as my infection or the use of drugs like corticosteroids. By the way, class, if you are into corticosteroid therapy, one adverse effect of that is actually diabetes. Kapag pirmi ka magsigig inom og any corticosteroid, pwede siya mauwi into diabetes mellitus because corticosteroid can cause resistance to insulin. Okay? And then at the same time, dehydration leading to non-ketotic hyperosmolar coma. Makomatose class ang patient na magkaroon og very high glucose level due to the type 2 diabetes mellitus. So what happened to a patient with non-ketotic hyperosmolar coma? The blood sugar level will increase 6 to 20 times the normal range. How is that possible? What is the normal range? 110 times 6, moabot og 600 ang imuhang blood glucose level. Grabe na yun na insulin resistance or deficiency sa insulin, and that will alter the consciousness of the patient. That is why you call that non-ketotic hyperosmolar coma. And this one, syempre nakoma nga ang patient, so this one requires urgent medical care and rehydration is required. Si ano kasi klase sugar, si glucose has what do you call that? Naana siya osmotic nga property. So kung asa si glucose, musunod si water. So kung for example, daghan og glucose ang imuhang blood, so ang imuhang water in the body will go here. Example, even the water in your brain will go here. And what happens sa imuhang brain? There will be dehydration leading to loss of consciousness. That's non-ketotic hyperosmolar coma. These are complications of type 2 DM. Aside from the cardiovascular disease, aside from the kidney failure. Why do you think mag-fail ang kidneys if you have diabetes mellitus? Why? Why mag-fail sa kidneys? Nganong nahimo man na siya og complication aside from the cardiovascular disease. Let's wait. Pwede na mo mangutanan ni Google. Pwede ra po sa tanaw ninyo. Anong mag-fail? Diabetes can harm the kidneys by causing damage to blood vessels inside your kidneys. The filtering units of the kidney are filled with tiny blood vessels. Over time, high blood sugar level in the blood can cause these vessels to become narrow and clogged. Other answers? It's not because of the drugs. Mag-fail ang kidney. It's because of the high blood sugar. Remember, pag mag-filter ang atong kidneys, tanan blood, moagi sa kidneys, class. Now, since your blood is daghan kaayo og sugar, this will become viscous. Mura gud naghimo kag syrup, class. Diba? Pag mahimo kag syrup, pagka mo daghang sugar ang imuhang tubig, masa siya, maglapot siya, maging viscous siya. So pag moagi na sa kidneys, sa mga blood vessels sa kidneys, magka-problema jud ka. Lisod na niya i-accommodate ang viscous na blood, and mahimo na siya narrow, mahimo na siya clogged kadugayan, mauwi gid na siya sa kidney failure. Mag-overwork man imuhang kidney for this. Maggrabe iyahang trabaho because of the viscous blood. Okay? So, mao na siya ang problem with the diabetes mellitus kay magkaroon ng kidney complication. Aside from non-ketotic hyperosmolar coma. Okay? Now, let's differentiate the two kasi mo ni ang mga common nato na mga diabetes mellitus. For the age of onset, type 1, mention ako na kagaina, mostly during childhood or puberty. So, even si Gary V, bata pa siya, na-diagnose iyahang type 1. Si Mona, yung example. But ang type 2 diabetes mellitus is most of the time, commonly over age 35 na siya. Pero pag dito magtarong sa ato ang lifestyle, pwede na siya mugawas na napata sa ato ang 20s. Okay? Nutritional status at the time of onset. Commonly, they are undernourished. So, makita ninyo, mostly sa ilahang mga payat, mga stunted ang ilahang growth. Kasi undernourished ang mga people with type 1 DM. But ang type 2 DM baliktad. Kasi ingon ko kagaina, either overweight or obese. Kasi the inflammation caused by the fats present in the body will lead to resistance to insulin. That is why urgent ang pag-diet. Okay? Dili pwede ang overweight o ang obese kay mauwi gid na siya sa DM class aside from the cardiovascular disorders. Next, prevalence. 5 to 10% of the diagnosed diabetics in the world actually has type 1, while 90 to 95% ang type 2. So, mostly good type 2 DM ang prevalent sa worldwide ni siya, worldwide. Now, genetic predisposition, kung may factor ba ang hereditary anina sa having type 1 or type 2, moderate lang sa type 1 actually, but sa type 2 very strong. So it can be passed on from generation to generation. Now, what is the problem with type 1 DM again? There is destruction of the B cells. Thus, there will be severe or absolute insulin deficiency. While sa type 2, there can be problem with the beta cells. Mag-produce siya pero kulang. But the main problem with the type 2 is the insulin resistance. Okay? Dili kaayo take action si insulin, di siya makabind sa iyahang receptors. Na napod tayo ginatawag og type 3 diabetes mellitus. It has nothing to do with type 1 and type 2, no? Pero ang pangalan gid ani sa mga books is others. There are other causes why there is elevated blood glucose level. So for example, pancreatectomy, removal of the pancreas. So wala na yung pancreas ang patient, wala na yung mag-produce of insulin, and that will lead to elevated blood glucose level. So type 3 DM ang tawag ana. Or the patient has pancreatitis, inflammation of the pancreas. And then pancreatic disease and drug therapy, like ako na-mention, corticosteroid. Corticosteroids can lead to insulin resistance. So, pwede mag-elevate ang blood glucose level and also the Alzheimer's disease. Type 3 DM na sila tanan. Other causes of elevation in the blood glucose level. While the type 4 diabetes mellitus there is still increase in the blood glucose level that is detected first time during pregnancy. Wala kay sakit, wala kay DM. Tapos nasawa ka, nabuntis ka, and na-detect first ka nagkaroon ng abnormality in the blood glucose level during pregnancy. Type 4 DM na siya, or we call that gestational diabetes mellitus. So what is the reason? This is due to the placenta or the hormones produced by the placenta that will lead to insulin resistance. So it is more pronounced during the last trimester of the pregnancy class. Pag-check sa blood glucose level sa buntis ani, elevated iyahang blood sugar level. I think I know someone na estudyante dati sa doctors na pharmacist na karon na nag-type 4 DM siya during her pregnancy. So during her pregnancy, kada week sigig inject og insulin. Kasi dili man pud pwede ang OHA kay most of our OHA dili man siya safe sa bata, sa fetus, sa sulod. So insulin gyud, inject pirmi og insulin. Again, that is due to the placenta and the placental hormones being produced. Mo nang ginaingon class nga dili lalim pud magbuntis. Yeah, after mga anak kay mawala ra pud siya. Okay, mawala ra pud siya. Kay wala naman ang placenta, gigawas naman pud ang placenta, di ba? And wala na yung mag-produce of hormones. Ma-transfer sa baby? No. Dili siya ma-transfer sa baby. Ang mama yun ang mag-suffer sa gestational diabetes mellitus. Okay? So ang mama mag-suffer kada week inject og insulin hangtod mga anak siya. Okay? Questions? Wala? Pero katong estudyante dati sa doctors kay kada week insulin and check pirmi o glucose level tapos lain ra ba kay ang dili ra ba fasting blood glucose lisod pud ang buntis mag-fasting no. So ang gina-test sa iya is OGTT. So oral glucose tolerance test. Paimnon siya pirmi atong lain kay glasa nga glucose solution tapos i-check iyahang blood glucose level after. Dahil dito siya glasa, pero may ko siya makita sa laboratory dati sa mga medtech. Okay? Walay pangutana.